request Dr. Kannan Pugarendi to please stay back, along with Dr. Siddharth Unnithan to please stay back, and Mr. Vallabhan, I request you all to stay back for the next session. The next session is going to be hamstring strain. For this, the moderator and the speakers, I would like to call upon the moderator, Mr. Ernest Paul, Deputy HOD at Ortho-One ABTP Department of Physiotherapy and Sports Rehabilitation, orthopedic physiotherapist for the Indian swimming team during the 2022 Mare Nostrum Swim Series, Monaco, Spain and France. He has worked with many elite athletes from different sports like swimming, badminton, football, cricket, volleyball, athletics, tennis, hockey and kabaddi. So we have with us Mr. Ernest Paul. Along with, I would like to call Dr. Sarthak Patnaik to please join us on the stage. Dr. Sarthak Patnaik, kindly please join us on the stage. Along with Dr. Rajini Kumar, I request you also to please stay back on the stage. And I'd like to call Mr. Herben Lebenberg. Sir, kindly please join us on the stage. And we have Mr. Vallabhan, the Director of Phoenix Academy of Sports and Orthopedics, Saidapet, Chennai. MPTH, MPT, Meenakshi College of Physiotherapy 2009, PG Diploma in Emergency Trauma Care, Meenakshi College of Physiotherapy, certified in sports taping, has worked as a sports physio for cricket, kabaddi, football, cycling, hockey, basketball and athletes. Thank you, sir. Thank you so much. Now we'll start the session. Thank you.
So good evening, guys. Good evening. Okay, so my topic is on hamstring strain. These are the contents. We'll be discussing about terminology, anatomy, sports-specific biomechanics, then injury mechanism, red flags, an exercise program, and guidelines. So again, these are the basic terminologies. Right from the morning, we were discussing about this. It's about isometrics, you all know. Next is isotonics, you all know about it. Concentric, eccentrics. And isokinetic work. Can somebody define what it is? So it's the movement happens at a constant speed regardless of the amount of resistance applied. Okay, even if you apply 1000 kgs of force, the speed of the movement, it's going to be constant. You need a special device to execute this particular exercise. So next is hamstring strain. What is a muscle strain? Any injury to the muscle, it's called as a strain. And it has got 3 grades. 1, there will be micro rupture of fibers, and 2, there will be partial rupture of muscle fibers, and 3, there will be complete rupture of muscle fibers. That is a muscle strain. Now, to understand about hamstring anatomy, I call upon Dr. Sarthak.
Yeah. So you know, my question comes, how many? Who is he? Can you raise hand? Yeah. I can't hear. Michael Jackson. So why did you show Michael Jackson? So which muscles is used for this? What step is this? Moonwalk. So which muscle is used? Terila. Kunjum. Okay. Okay. Sorry. Next video. So you know, even it took me from I've been seeing him since when I'm a small kid. Even it took me many years to know which muscle helped him. And what about him? Who is this runner? Sorry, I can't hear you guys. Usain Bolt. So which event is this? It's 100 meter or 200 meter? It looks 100 meter. So apart from which muscle is then on full throttle in this when a patient runs for the sprint? It's mostly the hamstring. What is the other support muscle which helps him? Which you should look in a sprinter runner, apart from the hamstring? Sorry? No, it's a psoas, which is equally important. So, to go ahead, the anatomy, we all know that hamstring, as we all can feel, it's quite simple to feel. The surface anatomy is easily palpable also. It's only in case of an obese female or a male, we do have the problem. But all the 3 muscles, what are the 3 muscles? Can we have a shout? semitendinosus, semimembranosus and bisemembranosus. What is a fake muscle in this? Sorry? Short head or the long head? Why is it known as fake? Because it comes from the linea aspera, right? And still it comes insertion. So as we see in this video, this muscle, the initial was the semi-T. We started from the ischial tuberosity, and where does it get inserts into? Yes, I want to hear the noise. Yes? Semi-T inserts at pes anserinus, which is easily palpable. So if you feel your tibial tuberosity, to slide it medial, you could feel the pes anserinus. Okay? And this is again the semimembranosus is again arises from the ischial tuberosity, and where does it insert into the medial femoral condyle. So it goes slightly up. Then we have the bicep femoris, which is the short head and the long head. Okay, since it is the short head, is a fake muscle, so it's predominantly the biceps. The long head, which you are concerned, it's also arises from the ischial tuberosity. Where does it inserts at the? Where does it insert? Ayo, one answer, please. Somebody. Where does it inserts? Femur, tibia. Which bone does it insert? Sorry? Fibula. Good. Can you just raise your hand, young man? I heard a boy's voice. Very good. So we do have a T-shirt. So clap. So that's as with the tip of fibula. So that's the basic anatomy of hamstrings. And once you know, we are going to discuss in the strain and the various rupture. You will be seeing all this. And what is the main function of hamstring? Flexion. Sorry? Yes, very good. Okay, thank you very much.
Thank you, sir. And to summarize, knee joint, it does flexion at the knee joint. Hamstrings, it does flexion at the knee joint. At hip, it does extension. And at pelvis, it does posterior pelvic tilt. And it does external rotation and internal rotation of the lower leg. And all the hamstrings are a two-joint muscle except for short head of bicep femoris. Next, I call upon Dr. Rajani Kumar to talk about the hamstring biomechanics.
Thank you. When it comes to hamstrings, the muscle fiber structure itself, predominantly it is spindle shaped. When it comes to length tension relationship or force velocity relationship, so when you increase the force, the velocity is reduced. When you increase the speed of the movement, you cannot produce more force. So as we saw in the isokinetic dynamometer, so isokinetic dynamometer is an equipment. You can perform an activity at a fixed speed, say for an example 60 degrees per second. At 60 degrees per second, when you measure your hamstrings quadriceps ratio, you can find out the difference. When the speed of the activity is increased, like 120 degrees per second, 180 degrees per second, 240 degrees per second, that means you are increasing the speed of the movement. When the speed of the movement is increased, the production of the force is very less. So during the sports activities, the force production and velocity is somewhere in the mid in the continuum. That is one aspect. And with regard to the loading of hamstrings, as rightly pointed out in the initial introduction of the functions of hamstrings, hamstrings is responsible for knee flexion and hip extension predominantly. And when it comes to active insufficiency, say for an example, concentrically loaded, when you want to train, right, your hamstrings, right, you can run on the hill, steep hill, At the same way, when you want to eccentrically load, reverse. That means during the, while Usain Bolt was sprinting, during acceleration, right, you can find the hip flexors are working. At the same time, during knee flexion, your hamstrings are functioning. At the same time, when you go for deceleration, that means during the contact, naturally we tend to decelerate. When there is a deceleration and your foot is going to be in contact with the ground, during that time hamstrings are eccentrically loaded. That means the muscle is lengthened, fiber length is there while it is loaded. So that is eccentric loading. So the hamstrings muscles, as I told you, spindle shaped. The spindle shaped muscles are having better length and they can produce more speed. But when it is not trained, strengthened, obviously when it is loaded with maximum speed, that means when you sprint or when you play any sport which is acceleration in nature, obviously it gets injured. That is one aspect. Next please. And as we discussed here, you can find a hurdler. During hurdling activity, you can see the hamstring is stretched and he is going with maximal velocity at the time of crossing over the hurdle. In the morning itself, people said when they were discussing about jumping, this is not jumping. This is running over the hurdle. Hurdling is not jumping because it has both horizontal velocity as well as vertical velocity, and they go with controlled speed. For example, if anybody is a 100-meter sprinter, he need not decelerate. Because of the fatigueness, he will decelerate. But when it comes to hurdling, it is predetermined speed because he already decided how many number of strides between the hurdle, what are the number of strides between start to first hurdle, because already it is fixed. And the third one is when it comes to sport, when it comes to football, basketball, volleyball or hockey, field sports, consciously you have to decelerate because you have to accelerate, and the moment you near to the ball, you have to decelerate. Whereas in athletics, sprinting, right, you keep on accelerating, because of fatigue at the end stage, you decelerate. But in sports, you consciously decelerate. That's why the hamstring injury, right, is more predominant, right, in field sport, contact sport, than in track and field. Next, please. And so, the hamstrings will be functioning in different way. The upper fibers and lower fibers. When you step up and when you step out, that's why we say sit to stand. Sit to stand, hamstrings as we saw in the video about Michael Jackson, right? He was doing the movement. The hamstring is completely active. Next, please. So when it comes to, this is particularly just to understand. So anatomical cross-sectional area and physiological cross-sectional area. So when it comes to physiological cross-sectional area, so that is the one which is more important, where the muscle can produce better force. And when the muscle fibers are spindle shaped, you can just, right, take the anatomical cross-sectional area. When the muscle fibers are oblique in nature, and you have to take about physiological cross-sectional area. And there are some basic exercises we do. So this is the hamstring quadriceps ratio, which already we discussed. And Nordic curl is the one frequently we use to strengthen and test your hamstring strength. Thank you so much.
Thank you, sir. And Next, before going to the mechanism of injury, I would like to call upon Dr. Siddharth Unithan to talk about the red flags in the differential diagnosis. So we just wanted to know how the patients will present to you on field and in your clinic also, and what not to miss, what are the red flags, and when not to play.
Yeah, so there are three aspects here. So presentation usually they are called an audible. There will be definitely you will feel a pinch on your back of your thigh, or you get this type of bruise. If you see this type of bruising, then you know that it's a very bad hamstring injury. Or he's not able to do even walk properly. Usually an athlete, it's very easy because they will themselves tell, I've got a hamstring, I pulled a hamstring. It's very easy for me as a diagnostician to immediately tell that is quite immediate. So these are the usual presentation where pain can occur. Now what not to miss, as I said, you have to examine one joint above and one joint below always. Because what happens is that in certain cases, and since if you see me, I'm quite dark, I'm not going to see any bruising in my leg. So what happens is that you might miss the bruising completely, or there won't be any bruising at all if there is something else. So that time you have to examine other areas as well, because you can get back. You might have a disc prolapse which can radiate downwards as a pain. You might have a meniscus tear which can also, you can have a burst Baker's cyst. So these are all terminologies to say that there are different formats of injuries which can occur, which you have to always eliminate along with hamstring injury. This is the major thing which you have not to miss. And when not to play, usually there is a return to play criteria is there, which is the next session, as when to play, when to go back to play, when not to play, when what are you going to play? That is the first thing which I ask. So if it is something which is quite severe, very sudden, and we have to load quite heavily, and you are not able to even run, definitely I'm not going to say, because you're going to worsen your injury. It depends upon a lot of factors actually. It's a very complicated question as whether to make an athlete run, because if you're going to have the World Cup finals tomorrow and your Messi is having a hamstring strain, and if I'm going to say don't play, I'll be looked as the worst villain in the world. So you have to know when to say not to play also. It depends upon what competition you're playing, what activity you're going to do. So these are the criteria. The main criteria is that if you have an injury such as this, where you have a black bruise like this, I'm definitely going to say not to play. So these are the criteria. There are a lot of criteria to return to play also. So if you are able to flex normally, you are able to do against resistance. If I'm going to bend, a Nordic curl, I'll make you do a Nordic curl and you don't have much pain, I will definitely consider you, I'll allow you to play. So these are the conditions in which I will allow to play, and conditions of not to play. I'm making it very short because we are short on time, so I'll send to Ernest.
Thank you so much, sir. So now we'll go to the injury mechanism. Now I have a video by Herman, and after this video I'll be playing another video. That's the Hussein's Bolt's hamstring strain video. I want somebody to come out and answer for that. Okay, so listen carefully.
The most common mechanism
Volume,
of injury
please.
of the hamstring is eccentric contraction. This occurs in the lengthening, when the muscle is lengthening under tension. This also usually happens in running or sprinting, specifically in change of direction, decelerating, and in the late swing phase of running. Another mechanism of injury of the hamstring is overstretching. That's when a muscle is stretched beyond its capacity, like kicking a ball or extensive flexion of the hip. So usually when a muscle is injured, it's when the load is more than what the capacity of the muscle can handle. So when the muscle is used to a certain amount of tension, then the muscle can handle it. But when the tension is more than what the muscle can handle, that's when injury occurs.
Okay, you understood? Guys, you understood? Yes or no? Okay, now I'm going to play another video. Now you have to correlate the injury mechanism to this video, and I want somebody to come forward and explain it. What is happening over here? What's the reason for his injury? Anybody in the crowd? What's happening? Sorry? Wrong Wrong landing, anything else? What's the reason, mechanism of injury with respect to this video? Okay, let me explain. When he's taking his strides, his hip is going into flexion where there will be a lot of eccentric load on the hamstrings. At the same time, his knee is going into extension. That puts a lot of load on the hamstrings. That's why there is a failure of hamstrings. Okay? So eccentric overload, that's the cause for his hamstring injury. Now look at this video, what is happening over here. Now can you tell me? Straightforward. What had happened? I'll replay it again. Now you tell me. Look at this. You heard it? Okay, the previous one was eccentric overload and this is hyperstretch. There are two mechanisms. Got it? So there is rapid extensive contraction, and there is excessive stretch. These are the two mechanisms. When there is excessive load due to eccentric contraction during the late swing phase, the hamstring fails. When there is excessive load, the strain happens in biceps femoris. And when there is excessive stretch, the semimembranosus gets strained. Okay, differential diagnosis. This is over. And the next thing, it's the assessment guidelines. So at Ortho-One, what do we do? The first assessment, see, clinical assessment is straightforward. If we know the hamstring is strained, you have to go with the palpation. You have to palpate the entire length of the hamstrings, right from the bulk, right from the origin till the insertion. Okay? The extent of the tenderness and pain correlates with the severity of injury. And you have to mark the area of tenderness and pain so that you can monitor the progress of the patient. The second assessment guideline is forward bending. Ask the athlete to bend forward and mark the area where the pain starts. Okay? And the third thing is strength testing. You have to test the strength at multiple angles. Strength testing should be done at outer range, mid range, and inner range. If you have a dynamometer, you can monitor the strength parameter as well. Okay? And if you don't have a ISO handle dynamometer, what you can do is you can just monitor the angle at which the pain is produced. And the next thing is passive SLR. Just you have to lift the leg into flexion, hip into flexion passively, and just note down the range of motion at which the pain starts. And the next assessment guideline is maximal hip flexion and active knee extension. This is to check the flexibility of the hamstring muscle. And wherever the pain starts, you just have to mark and note down the range of motion. And this is single leg squat. We have been hearing about kinetic chain right from the morning. This is to test the integrity of kinetic chain. Any injury in the lower body, the integrity of the kinetic chain will be lost. Okay? And this is an amazing device that's called as isokinetic strength testing device. In our hospital, we have a device called ISO-Move. This is used to test the strength of the hamstrings and quadriceps. And in this case, we test the strength of the hamstrings and compare it with the opposite side. Right. So next, moving on to the next thing, rehab guidelines. So there are two published protocols. One is AskLink protocol, and the second thing is recently published Aspeta protocol. In AskLink protocol, there is three key exercises. One is the extender, the second is the diver, and the third is the glider. All these three exercises should be present in your rehab program because studies have shown that people recover faster when they incorporate these three exercises in their rehab protocol. So this is knee extender, where the athlete has to lie on the back and hip has to be flexed to 90 degrees and they have to extend the knee joint. The mobility and flexibility component is involved. In the second exercise, this is called as a diver, in which eccentric component is involved. And the third, the glider. In this exercise, the testing leg has to be kept static on the floor and the other leg has to be kept on a sliding board or a skater board, and the athlete is asked to slide backwards. And this puts a lot of eccentric load on the affected side. And on this, flexibility component is involved, concentric component is involved, and eccentric component is also involved. And this is, everybody knows about this important exercise. This is called as a Nordic hamstring curl. See, gliders, sliders, and divers can be included in the initial phase, but Nordic hamstring curls should be included in the advanced later stages. And what do we actually do at Ortho-One apart from these gliders, sliders, and divers? We initially start with isometrics at different angles. We focus on recruiting all the muscle fibers. When they are comfortable with different angles, we elevate the leg and do the isometrics. If there is no pain, we start with, again, not only isometrics, we also do core exercises, and we concentrate on one joint above and below. Again, it works on the kinetic chain principle. And when they are comfortable with bridging, we progress to single leg bridges. And again, calf raises also will be included in our protocol. Glutes and the calf muscles, those aid in the healing of the hamstrings and faster rehab, recovery. And squats, again, this is to maintain the functional property and the muscle property of the lower body. This can be included in the second phase. And along with the other exercises, we also include knee extenders. And once they are comfortable with all those exercises, we progress to isotonic exercises. This is basic leg curls. And they are comfortable with isotonic exercises, we progress to eccentric hamstring curls. Is it clear? And again, this is one beautiful compound exercise called deadlifts. This is for hamstrings, and again it loads the hamstrings eccentrically. And again, divers, gliders can be included. And we always finish with Nordic hamstring curls. And also the isokinetic strength testing device is not only just for testing, it is also for training also. We can set the velocity at which a muscle has to be trained. Usually the testing in our hospital, the protocol is we test at 180 degree per second angular velocity and 90 degree per second angular velocity. And we can train on this device as well. And obviously we have to stretch the muscle which is injured. This is how we stretch the hamstrings and calf muscle. So, return to sport guidelines. This is the last guideline. So all these tests, whatever we have conducted, that has to be repeated again. And there should not be any pain at all. There should not be any tenderness, and there should not be any spasm of stiffness. And in the isokinetic testing, there should not be a deficit of more than 10% when compared to the opposite side. And all these running drills has to be initiated. And again, with the running drills, there should not be any pain, no tenderness or stiffness. Thank you so much. So any questions? Okay. If there are no questions, we'll move on to the next.